Hi, my name is Paul Ebokwansa, and I welcome you to CMGH TV. This is DWENEHO-BI. DWENEHO-BI is about two of us discussing or reasoning together about the problems confronting us. If you would agree with me, COVID-19 is our problem today because COVID-19 has taken over our homes, our offices, in our marketplaces, killing people, making children orphans. Governments in the whole world are struggling to get remedy of the insurgence of COVID-19. Join me as I host Madam Asor. Is a senior nurse from Kole-Bu Teaching Hospital, and we are going to discuss about the surge of COVID-19 in Ghana. Who is sick? What are the prevention measures and the free testing announced by the government? But then, let's go for a commercial break. After that, we continue. Welcome back. Our guest for today's discussion on DWENEHO-BI is Madam Asor Osei Bonsu from Kole-Bu Teaching Hospital. The COVID did not contribute to the rise of the COVID-19.
Fine. Initially, we will say it's because of the non-adherence to the protocol. Protocol, on the West States, we should wash our hands. But when the condition started, we were really doing what was said. So it started coming down. But I refuse. Say food that were too much of we were so comfortable with the current trend and maybe the money. We thought because the condition has been there for over a year now. You need to, in fact, remind somebody that you need to wash your hands before. But the thing is that what is really contributing to is that we're no longer washing our hands regularly. We became so ignorant. So I didn't say that wash your hands before you enter. Oh, I just finished washing my hands. I said there's no point washing your hands over and over again. But the issue is you need to do it over and over again. That is the only way you can get rid of the virus. And then in fact we are not washing. It's supposed to be washed under running water with soap. And then also we are not really wearing a face mask. Even if you are doing it, you are not doing it consistently and correctly. Consistently, if you are wearing it, you are wearing it. And I say if correctly, so nowadays we don't really wear it like the way I am wearing it. It's either only on the mouth or under the chin. And then when somebody wants to talk to you, that is when the person, because you can't hear, the person has to remove it for you to hear. That is one of the contributing factors. So if I talk to you without a face mask, saliva comes out. All that the virus may even come out if I have one, and you are so close to me, the virus may come out. And then all you need to do is to breathe in. That is how it is actually spreading. We are not using our sanitizer the way we have to use it. Sanitizer is supposed to be alcohol based. But now, why do you have from? It looks jelly like, it looks, all sort of things in the market. It's supposed to be 70% alcohol. We are so sure that our 93% of the virus can be gotten rid of as we wash our hands and we apply the sanitizer. And then when we are applying, we just don't apply small. But you bath your hand with it. And then it evaporates. Then we know that whatever is in your hand, we are sure that you have gotten rid of some. So it's just about forgetfulness there. You need to wash your hands. The thing will be there. The facility, the washing facility will be there. Just wash your hand. You will not do. Okay.
Yeah, kind of factors are ama yareno akoto. What 2020? Na update in your feed from the president. No, just say your boy home modern. Okay, to curb the disease. Okay. December 7 election. What should the world rally or more ya kabo bobo boso. You being share sa no scovia ye can. Okay, that time you're very active.
No, the one
was very serious. It's the point. We share 7 in December election of Abasino. Jubilation you do because our candidate have won. Next we share Christmas you do 24th, 25th, 26th. Beaches. We must say Yako Beach. Okay. Next we share 31st watch night. Yeah. I'm not supposed to contribute to the rise of the disease.
Yes, will contribute in a very big way because social distancing is very important. You can wear the mask all right, but social distance also. Don't say because I'm wearing it, the distance should be so close. There's a reason why we said we don't need to be so close. We need to be social distant ourselves from each other. And then also overcrowding or contribute greatly. Because from your home, you're bombarding too much in them as well. Virus will transmit in tam. Because everybody is shouting, no face mask, nothing. We are just so close, jubilating. We are at beaches, we are at parties. So if you see somebody you have not seen in a long while, you mask and say shampoo, then you talk to the person, you hug it. At a point, we were only using the elbow, and then we got to hugging because we've not seen the person in a very long while. So we're crowding. But me, like what night? The person is just afraid. I mean, so furious there is to face mask.
You are to
from and then a bomb pay there 31st and I don't 31st and about to first our room of New Year as a mammy tunum as a mammy like I shouldn't jubilate. That is not true. I feel so the one there so up one day some people may have the virus, either they are afraid to do it. And it may be too costly for them to.
So, Oko Abrochira won. Abrofono, so be will be a feel free of more COVID. So I'm going in isolation. But blacks no, you will be an air hide. And you wash a juma more yana.
One thing that's really caused this thing is stigmatization. Obinyebi. Not the but before that the person is an outcast. When you're BB or you're deadly. But if you show love to the person, within some 14 days, the person should be able to recover. If the person has good immunity, the person should be able to recover within 14 days. So you don't need to really let the person feel like an outcast. There, when you're that person for them. No, but if that's the reason why people are not coming out, people hide.
No, more spread
the HIV crampon, they don't even hide to do that.
For what you are saying, like contribution factor of the rise of this,
also be that.
For family members, you receive. Okay.
Another will be then people will start running away. Even if you recover, the way a manner they treat you in a society, the man will be soon the person is not able to come out to say, oh, I had this. But if we go to if we work well, if you treat people well, they'll boldly come out. Because then they may not be from. What matters the positives to their condition? What should I do? You don't really need to come to the hospital because you may not know what you sit in church to come to the hospital. So if you are coughing, you may be in face mask, but there are spaces here. So if you don't take care, it can come out. Because you don't wear the face mask well, it's possible that the virus can come out and spread to the next person. I go to line, it will queue before coming to the hospital. So and then when you come to, it's going to be a queue. So you are likely to spread it before you even get to the hospital.
Yeah. Second COVID-19. No COVID no.
We call it the new variant.
New variant.
Yes. It's almost like the first one, but it's more contagious than the first one. On the first one, everybody can get. But the issue is if you have an underlying medical condition, it worsens it. But this new one, whether or not you have it, you can get it. That is we realized that when the president was giving the update, he mentioned that the new one, some of them brought it into the country. You see, it started way back in the United Kingdom. How it emerged, it's not so clear. Within some few weeks, it has taken over the viruses, and then it's in London. So that is how it started. Then there's another one too from South Africa, the new variants. Some also started from South Africa. It started from 3 provinces. This time it has also taken over.
So we have how many COVID-19?
Just one or 2. The new variant and the old one.
Okay.
Just that the new variant, some started.
Some started in UK and then.
So I believe because
Africa.
Of traveling, people bring it into the country. And then, so right now there are some researches going on to see how serious this one also is affecting the populace.
Could it be possible, say,
one or the bunch of because of UK.
But yeah, testing over airport. You pay $150.
If you have
yes.
So those who are found to be positive, they are isolated. But those who are not positive may not be showing anything too. But over general population more. And then be if you are by come and welcome, come and day. But in a brum nadi. Before you realize what to party man. People will come. They'll be talking.
Yeah. Test what airport or not test
if you are negative.
So probably out of which I turn to positive.
Oh, negative cannot turn to positive. No, if you can be negative today, but you can be positive tomorrow. Because if you are time you are not showing anything. It didn't pick up the specimen that was taken. It didn't show anything. You understand? So ideally, what to come by, you should isolate yourself for like 2 weeks, just so that if you have anything, BB or your transmissibles, it can be with you within, because we know that within 14 days you'll be fine. Everything that you have can just subside, then you can be with your family.
Okay, so the abnormal symptoms it's saying.
Oh, what you demand the old one? Just that you see, with the old ones, you can have the rise in temperature, you can have cough, you can have cold, you can have all those things. But even one of them alone can let you have the condition. Somebody had just sore throat, and it was positive.
Now, coffee, sometimes from a mobile,
oh,
was it you from them or what?
The women going to feed them. You see, the thing is like, it looks like malaria. So people start treating malaria. And then malaria, another on cough, you start coughing. So you see, there is coughing, there is runny nose. Sometimes the eye will it will pain you, it will get itchy, then it gets red. So when it's continuing like that, but one main thing is that there's loss of smell. So in your malaria, now it treats now, look at typhoid too, it treats now, then you'll be looking at, but you see, it will take some time. Before, them treatment, each one will take like 3 days, another week or 1 week. So by then, when I realize you would have spread it already, if it's really COVID and not malaria or typhoid. So you don't need to run it. So treat every cough, every sore throat as an emergency. So as you treat, so observe your body, the things we have mentioned, look at them. Saturday in your beer, not all cough, COVID. Not all difficulty in breathing can be COVID. Some can be pneumonia. You understand? So, but if you start experiencing these things, stay away from people. And then go to the hospital, seek treatment. It's better to seek early treatment before it's too late.
Okay. Let me put it. I say, America, in the UK, the way you people will be hurt because of COVID-19. Maybe within some seconds, within some seconds, no obuse. Sir, we do Ghana. Can we handle it? Hospital. What is saying?
We are trying. Because right now, the places are choked. The centers for treatment are choked. We all know that. So somebody will come. The person may not be severely sick. It can be some mild symptoms. So you treat the person. You let the person go home. And you tell the person what to do so that you will not infect another person. So that we expect that within 14 days you'll be fine.
See, what COVID-19 now? First, Nanko year only Accra, Kumasi, Tamana, Kaswana, Dibiana, was a hot spots. Okay, but see, what report of the breakdown regions in Iowa. What Greater Accra, you were 37,000 cases. Ashanti region 11,895. 3,395 Western region, Eastern 2,779, Central 2,000. Or the demand can see all the 16 regions. Okay, and the question is, who is safe?
Nobody is safe.
Nobody is safe.
Nobody is safe.
So
it's recently that children are also being infected by it. Yes, and then there was also a school, I think association or something that 17 of the children were also tested positive. So is this one that children, because children under 5 are not supposed to be getting the condition.
Okay. So, what school resuming now? School are you resuming? Then after then advice do you have for children, the parents, and the teachers?
Okay. For a successful term to end, we all have a role to play. The school has a role in this era. The parents and even the school children, they all have roles to play. Let's take it from the school. Before you even start, the school has to be cleaned. It needs fumigation. There should be wall ventilation because we need to open windows for fresh air to come in and then still air to go out. So if you close windows and doors and there's air conditioning, there should be less use of air conditioning. Yes, and then more use of the windows. Good. And then also the school should be able to provide the facility, hand washing facility at vantage points, so that we insist that every student washes their hand regularly, if you touch something or not, because you have no idea where you might have even gone to just stand. You don't know who is coughing, what you used your hand for. So there should be time or break time. There should be time allocated for hand washing. So these things should also come in handy. Sanitizer should always be available. There should be tissue. And then we should make sure that the students wear their face mask. The children should not be crowded. They should be isolated. They should just be distant. You understand? So that even if they are crowding, some can go out. They can have their classes outside. not on the sun though, just so that people will not be so crowded at one place. That is for the school.
Okay.
And then for the parents, you're supposed to make some provisions for the children. Provide all the necessary things. Children as they are, they like sharing. Somebody can take somebody's nose mask and all that. So it's better if you make provision for them. Provide them with the necessary sanitizers, hand tissue, whatever it is that they need to keep themselves safe. Provide them with good food. If your immunity is lowered, that is when the condition can come to you. But if you are strong, you have your immune system, everything is safe with you. You can even have the condition without even noticing it. Before you can say, Jack, it is even gone. By the time you start showing symptoms, you go for it. It will be like you are almost healed and you are good. So if the immune system is good, you don't get this kind of attacks, small illnesses. That is for the parents. Children too. Yours is supposed to be like, you're not working. So everything is being provided for you. Just put on your nose mask, your face mask. Make sure you do it correctly and consistently. Wash your hands intermittently. It's very important. And then they should learn good etiquette. When they are coughing, they should cough into tissue. And then put it in a covered bin. Immediately you wash your hands with soap and running water. Those are the ways we can naturally break the transmission. And then they shouldn't be crowded when playing. You know, playing, you don't really need playing. You don't need to go to assembly and all that. You understand? And then when the child is sick, it should stay away from school. It's better.
Okay.
Because the rise in temperature and all that, there are also signs of COVID. So just so that we don't mix up, we don't miss any of them. When the child gets up, if the child is coughing or having a rise in temperature, if the child is ill, stay away from school. Even if you are a teacher and you don't feel well, don't come. It's better that way.
Very good.
Yeah, for the safety of the children.
Yes, sir. We need to check temperature. No, Udru saying no, just say you at risk.
When is it ideally it's supposed to be like between 36.2 to 37.2. That's the normal range. So we are like 38 plus. You know what things are not well.
Okay. Your education in fee, Madam Asor, Snr Nurse from Kole-Bu Teaching Hospital. Very important. Me just say who follow her, it will help you. Men ye Asor what trust room in our marketplaces, in offices. Please let's try as much as we can to observe these protocols, and it will help all of us. And I answer, Yerbe, not the worst. May God forbid. This is DWENEHO-BI. God willing, we shall meet another time. Bye bye.